Hey guys, I'm so excited to talk to you today about something that's incredibly important for every woman out there: cervical cancer screening. As a healthcare professional, I can't stress enough how crucial this is for your overall health and well-being. So, let's chat about what cervical cancer screening actually is, okay? There are two main tests we use: the Pap smear and the HPV test. The Pap smear, which we do every 3 years for women between 21 and 65, checks for any abnormal cells in your cervix that could potentially, turn into cancer. Now, the HPV test is a bit different. It looks for high-risk strains of the human papillomavirus, which is like the main cause of cervical cancer. This test is typically recommended every 5 years for women between 30 and 65, or it can be combined with the Pap test. The amazing thing about these screenings is that they can detect changes early on, before cancer even develops. This means we can intervene early, potentially preventing cancer altogether or catching it at a very treatable stage. Now let's talk about who needs to get screened and how often. If you're between 21 and 29, you should be getting a Pap smear every 3 years. For those of you between 30 and 65, you have options. You can continue with the Pap every 3 years, or you can do the HPV test every 5 years, or even both tests together every 5 years. But guys, screening is just one part of the equation. There are other things you can do to reduce your risk of cervical cancer. Getting vaccinated against HPV is super important, especially if you're between 9 and 26 years old. Using protection during sex, quitting smoking if you're a smoker, and boosting your immunity through a healthy diet and exercise. All of these steps can make a huge difference.